So welcome everyone to our second community conversations on bias in public health data. Today we're going to be focusing on the topic of reach. And to get us kicked off, I want to welcome Brian Dillard, our Chief Innovation Officer, and Jonathan Butler from the Office of Equity.
Awesome. Thank you, Leslie. And thank you all for joining and participating as an audience. I went over this on the first of the three-part series. If you're tuning in and you don't know, this is the second of three series. I'm recording all of them and keeping all the feedback so we can actually utilize it. So when I say thank you for joining and participating, I definitely emphasize participating. It is not just this hour that we'll be interacting with you. We'll be expecting feedback after this on the CivTechSA website. We'll have a third conversation that pieces into this. So definitely want you to be aware of that. Thank you as well to Geekdom and to Leslie and Eddie for running such a great program like CivTechSA that serves our community in so many ways. I want to thank our esteemed panelists for being on, and of course our moderator. I want to thank Metro Health and the Office of Equity. Equity continues to drive what we do in the city of San Antonio when it comes to serving historically disenfranchised communities throughout. We know that San Antonio has a difficulty with that, and definitely at the city of San Antonio, we want to focus in on that as we invest and make the right decisions as we move forward. And then last but not least, I want to thank council, mayor, and city management for allowing us to have these open and honest conversations. A lot of times it's tough to be in these humbled situations and kind of accept that you may not be doing all the right things, but at least you can open up and say, hey, how can we do the right thing? So that's what these conversations are really about. I'm going to touch on some things to kind of clarify why in the world are we here. What we hear about is really about systemic change. And as I'm told often enough, that really starts with data. It starts with the base level of collecting data, of processing data, and then how do we utilize that data? So that's why this three-part series is focused in on three things. So the first one was on identity. And again, you can go back and watch the recording on that. So about how do we identify when it comes to the way we gather data about residents, or us as residents, how we provide that data about ourselves. How are we counted in that count? How do we identify ourselves among that public response, when it comes to health issues, public health issues? Today's conversation is going to be on reach. So how are we reaching out? So cool, we identify what kind of information we get out of the surveys. How do we get the surveys out there? How do we collect data? Is it in a doctor's office? Is it at a public community event? In the realm of COVID, we have to do this in a digital realm mostly now. How do we do that? How do we make sure we're accessing people even in the space of digital divide being an impact? So identifying barriers to that reach. Our third series coming up next week, next Tuesday, same time, same place, is going to be on trust. So now that we've identified the data that comes in, how we're collecting that data, now what in the world are we doing with that data? So we know that nowadays AI and machine learning, computers are being utilized a lot more to process a lot of that data rather than your typical doctor's office. These are being stored in ways that public aren't really sure of. We want to make sure we're addressing that and letting you know how that works right now and allow you to ask the questions and get feedback about trust and security on that. That'll be the conversations for next week. So those three things, again, identity, reach, and trust. Those are the three things we're touching on with regard to this whole community conversation on public health data. Okay, so now you're asking, what is this? What am I doing here? What do I have to do with this process? We don't want to be here on these three series just talking at you. We want you to participate. Again, if you go to the CivTechSA website, and we'll post a link up here, and you can also go to the Facebook page for the event. You can go to the website, CivTech, we'll post a link up and you can get the exact web address. But the CivTechSA website, we have a case study available up there for you to reflect on when it comes to the way we collect data, surveys, the way we do that. We want you to reflect on that case study and let us know what you think about it as a resident. What's wrong with it? What do you like about it? We're seeking that community feedback so that we can review that as a team, as City of San Antonio, to support future data-driven policy processes within the City of San Antonio. So the feedback you give us is going to allow us to do our job better for you. Help us help you. That's pretty cool. So in addition to that, another layer of that is, as we work with Geekdom, there's a lot of economic development or workforce opportunities behind public health data and how we gather that and how we process it. So we'll also use that feedback to inform entrepreneurial efforts to create new approaches to working with that data. So very exciting stuff. I'm glad to have you all here, and I'm glad to have you participating. And now I'll hand it over to Jonathan Butler from our Office of Equity. Amazing guy. Thank you, Jonathan.
Thank you, Brian. As Brian said, I'm Jonathan Butler. I'm an equity manager for the Office of Equity. And the existence of our office is really to try to eliminate disparities that happen in our community and try to ensure that one's identity does not predict one's outcomes. We always like working with Brian and the team from the Office of Innovation, because not only are they critical in the data component and the compilation of data that they help engineer with throughout the city, but they always kind of plug us into some fun stuff too. And so we enjoy that opportunity to interact with them and interact with you all in ways that we hope advance genuine outcomes and improve outcomes for particularly the most marginalized members of our community. I'll say this and then I'll close and hand it back over to Leslie really quickly. If we have learned anything about the two pandemics of race and COVID happening in our community right now, we understand that the disparities experienced, particularly on racial lines and income lines, are even more pronounced, even more significant by what we've learned in our response as to the pandemic of COVID. I just say to you all, how we get and collect and manage data is critical in terms of policymaking, service delivery, advancement, and problem solving. And without, we are only as good as our accuracy and our ability to collect data. And that data drives then our policymaking and service delivery. And so you all are important parts of that process in ensuring particularly that we're able to reach hard to reach communities, populations who experience disparities, populations who can't participate effectively in the digital divide. And so you all's work is critical to that. So thank you all for including us as a partner. Thank you for inviting me even to just take a couple minutes to talk to you. And Leslie, I'm ready for this panel. So we'll turn it back over to you all to get this thing started.
Wonderful. Thank you so much, Brian and Jonathan, for giving us insight into why we're here today, why this is so important. All of this is just awesome to hear, so thank you. Very quickly, before we move into the panel, I did want to share what Brian was talking about. So we do have a webpage for you guys. So if you go to civtechsa.com/community conversations, you can find an overview of this project. You can register to attend the last conversation, and then you can also find the recorded videos and kind of info on what we talked about in there. As you scroll down, you can see we have our Metro Health case study materials linked here, and we have a public response board linked as well. And this is where this form right here at the bottom, that's what you need to fill out to let us know what you're thinking. Whether you watch this as a recording or live here in person on the Zoom, we want you guys to be giving your feedback. So if you have a thought after you've attended today that you didn't get to share, that we didn't get to capture, please come back to the website and interact here. And just to give you an idea as well on what these other pages look like, we have, this is our case study materials here. There's an overview and then the different items you can look through. We have a blog on our website as well, right here, that kind of breaks everything down for you and what the steps you can take to interact with this case study. And then once you have submitted your responses, they'll show up. We will add them here to a public Trello board. So whether you're kind of giving us feedback on one of these topics that we're talking about, or you want to give us feedback on the case study, that's where you'll see it. So please, please, please go to our website and send in your responses. We want to hear from you guys. So now I'm going to toss the mic over to our wonderful moderator today, Ms. Golareh Agha. She's from our San Antonio Metro Health Department, and she's going to lead us into our panel. Take it away.
Hi, everyone. Thank you so much. I'm so excited to be part of this conversation, and I echo everything that, you know, all the wonderful colleagues and sort of partner departments of ours have said so far. As the Metro Health person, I'm really, really excited to see the feedback that we have, because we're usually the one responsible for collecting the public health data. So I'm gonna not talk very long, and I wanna, you know, get over to our amazing panelists that are here for today. One thing I do wanna say is for all the people watching and listening in, and all the panelists to consider in terms of the topic for today, is today's discussion is about reach. So some of the questions to keep in mind is, who do we usually reach, and who do we not reach, and who do we need to do a better job of reaching? And another question is, and I think some of the panelists we like, how do we define who we need to reach, and what are the implications of that? So I think those are some of the questions to keep in mind. But without any further delay, I'd like to introduce our first wonderful panelist, Mrs. La Juana Chambers Lawson, MPA, PMP, LSSGB. She's the owner, CEO, and principal consultant of Tacit Growth Strategies, LLC. This is a nationally awarded and internationally recognized project management firm, leading a portfolio of government contracts, nonprofit, public and private sector professional development training, and a plethora of projects in construction, grant and proposal management, as well as information technology, so IT. Through her business, she works to systematically harness people power for success in life and professional through intrepid and culturally responsive leadership and management, actionable and data-oriented planning and goal setting, and an intentional commitment to leveraging information technology to bridge gap and communities for a better tomorrow. And I've had the pleasure of working with La Juana, and I definitely know she's as data-oriented as me. So La Juana, please take it away.
Thank you so much for that wonderful introduction, Dr. Golareh. So I'm going to go ahead and just share some of my opening remarks. I'm really excited about our conversation today, and I do want to tell all of our wonderful Geekdom, CivTechSA, Innovate SA, Office of Equity staff, thank you so much for putting this together. This is an exceptional conversation. So let's get started. So in one of my favorite books that I've been recently reading called The Alchemy of Us by Anissa Ramirez, is a great discussion about how technology has been used to further stratify the haves and the have-nots with inconspicuous sophistication. So Anissa's discussion complements my years of research and work trying to build the gaps in what we commonly refer to as the behemoth that is the digital divide in all of its intricate complexity and elusiveness. So the systemic disengagement and disenfranchisement of communities of color, unintentionally done by people and their technological creations, of course, creates and perpetuates, namely the first and second elements of the digital divide almost inherently. And the first element is affordable, robust broadband internet service, with the second element being internet-enabled devices that meet the needs of the user. There are, depending on who you're talking to, generally 5 to 6 elements of the digital divide that shape digital inclusion policy-making initiatives all throughout the country in my experience. And the first 2 elements of the digital divide are the 2 that I believe are the foundation of our discussion here today. So public health data refers to how we quantify and qualify people and the environment that they live in, leading to important conclusions that determine policy, programming, and other outcomes. The role that the marketplace of producers, manufacturers, and spectators plays in how we quantify and qualify people and the environments that they live in, both in person or in vivo, or virtually in vitro, is of august importance. With the expansion of great technological advances like 5G, understanding the public sector's role in hedging risk associated with deploying new technology and predictive analytics is timely, really late, right? But better late than never. The potential harm to our most vulnerable populations cannot be overstated. As we've seen with the coronavirus pandemic, we are all in this together. But the depth of the lasting impact of all of this loss and ruin has set many of us back inexplicably, and recovery seems too distant to be realized. Historically, the unemployment rate for Black Americans has been approximately twice that rate for whites. That's the case still today, and with the pandemic, it's actually worse. The wealth gap between Black and white households actually increases with education. Despite significant economic progress over the past decades, Black Americans experience far worse economic conditions than whites or the population as a whole. While infant mortality has fallen overall in the past century thanks to improvements in hygiene, nutrition, and healthcare, the Black-white disparity has grown. And this is all according to Congressman Don Byers' Joint Economic Committee report he gave in the first quarter of this year on the state of Black America. Overall, the U.S. ranks 30th among the 37 OECD countries for infant mortality. A CDC report published last year found that over 22,000 American babies died before their first birthday in 2017. Black babies died at a rate of 10.97 per 1,000 births, more than twice the rate for white babies, Asian babies, and Latin newborns. In Bexar County, Black women have just as an alarming rate in terms of mortality. We're looking at twice the likelihood in comparison to other populations. So a call to action for accountability, ethics, and social good are what the public, largely our spectators, must construct for our own welfare. And so again, I thank you for having me today for this very crucially important discussion.
Thank you so much. And I think that really touched well on when we talk about reach and who we need to reach. And you touched on the digital divide. And you sort of, spoke to things that are very close to our heart about when we do collect data, it systematically shows over and over again in certain health outcomes, how certain groups like the African Americans with infant mortality are much more affected. Yeah, this is a topic we've talked about a lot as well. Thank you so much. And I encourage everyone to ask questions or bring new ideas to discuss peek the sort of probe the panelists with their thoughts as we go through this on the chat box, and I'll be sure to read it out. Without further delay, I'd like to introduce our next panelist, and we'd love to hear from her. This is Mrs. Candelaria Mendoza. She's our fellow colleague in Office of Innovation, and we have had the pleasure of Metro Health and Office of Innovation working together on several projects so far. So Candelaria Mendoza's passion for enhancing the quality of life for her community has led to a successful career in public service. As the youngest daughter of a migrant farm worker family, she understands firsthand the many challenges that community members encounter on a daily basis, as well as the important role public servants can play. Her position in Smart Cities marries her passion with her perspective as she gets the amazing opportunity to focus on creatively solving community challenges by collaborating with many organizations to create a connected, inclusive, and resilient San Antonio. She's currently helping lead the Connected Beyond the Classroom project, as well as helping support the Digital Inclusion Task Force, again, a popular topic for today. So I'd like to open up to Candelaria to please share her thoughts with us.
Hello and good afternoon, everybody. Thanks again for including me. I echo the sentiments of everybody that went before me as far as having this conversation and excited about hearing everybody's feedback. I think I just want to echo some of the comments that Lajuana mentioned. I think we talked about it actually when we were doing the pre-meeting to this meeting around that catch-22 factor, the vicious cycle that's created because of our history and a lot of the elements that are embedded in what we have as a health system. I think we all know about projects that have occurred that creates this distrust in a lot of our health systems that, again, there's an issue of getting impacted the worst when it comes to people of color. But again, getting engagement and doing that reach is really difficult when you have to navigate and build that trust. So yeah, as they mentioned, we're, Emily, Brian, and I are actually all part of the Office of Innovation. And a lot of what we've worked towards around smart cities is that we want to be innovative, but we also understand that there's a lot of foundational items and issues that need to be worked on. So that's why it's great that we have this collaborative effort with Geekdom and other entities For us, we do really see ourselves as trying to be a change agent, not only for the community, but for the city, being an example of how we can do things differently. Because we know that as a governmental entity, it does take a lot of time. There's a lot of red tape that's been established forever and ever. There's a lot of tradition, there's a lot of status quo, there's a lot of sacred cows. So I think it's an opportunity for us to really have the city kind of look at things a little bit differently. One of the projects that we took on early on through the smart cities, which when you think about smart cities, I think people think about technology, they think about really cool things, they think about innovation. Digital divide might not come up as kind of an immediate thing that you think of when it comes to smart cities. But for us, the correlation is just so strong. Not only does it impact your health, it impacts education, it impacts workforce development, it impacts economic development. So we needed to make sure that we were tackling that as an issue, because if we really wanted to take advantage of what the digital economic world has to offer, we really need to be able to bring everybody with us that's part and included in this digital divide. So we took on the digital divide and through collaboration. So we went to council, we got approval for a framework, we partnered with UTSA to build a digital divide survey. So I think our biggest challenge with that was, how do we get to those people that are stuck in the digital divide? If it's going to be hard to engage them, we're going to have to go where they are. So a lot of our time and resources not only were built on building this collaboration so we can expand the word, but on the community engagement, on how we're going to reach these community members in these hard to reach communities. So we worked with our internal departments, with our GPA, and try to gather as much information as we could as far as who do you hear from when you push out a survey. And obviously, for the most part, it was districts from affluent communities. So we knew from the very beginning that we were going to have to put extra efforts, but it also takes resources. So we made a commitment to not only work with UTSA on the development of the survey, we also put in additional resources to the outreach. So because we were working with UTSA and in collaboration with the county, we were able to work with them to provide resources to expand that reach with UTSA students. So we had a commitment that we weren't going to just provide the survey online and in paper and in English and in Spanish and push it out through every form that we could digitally. But we also wanted to make sure that we were going out to where the community was already going to be. We didn't want to create events and have people come to them. We wanted to go where they were. We didn't want to create just another barrier for them to be able to participate. So we took students with us, we took iPads with us, and we went to over 65 community events across the city, across the county, over 200 hours of both staff time and student time to go out and help the community either learn about the survey or take the survey. So even if it came to us reading the questions and we putting them into the iPads, or the students doing that. Obviously having people that spoke Spanish as well out in the community, we did that quite a bit. And we were able to change the representation of that survey. So at the beginning, it was very heavy online in those affluent areas of town. But as we worked through do our community engagement, we started to see the voices of those that are underserved and underrepresented. And by the end of it, we were able to equalize representation across the city and the county so that we got a pretty equal amount of representation across all of our districts and also in all the age demographics. Could we have done better? Of course, we could always do better. And I think being able to have conversations like this so that we can build those systems of collaboration, of either working with yet another entity to kind of help us ensure that we're not just kind of ticking the boxes off, but is there ways that we can improve how we're asking our questions and really get meaningful data that will help us make decisions in the future. So we're excited that we completed that survey. At the end of the day, I think just as a disclaimer, it's definitely representing a moment in time. Obviously, of COVID, it probably makes that time even shorter because obviously COVID pushed us to a whole new world. So it is a representation of pre-COVID. So, and we in general kind of knew that even with the data we were getting, we knew that it was going to be, the reality of it, was that it was going to be even worse. So the data still showed us where our digital divide was, and now we just know that it's a lot worse now than it was when we took that survey. So again, understanding that data is data, but it does have a time frame of relevance. So seeking it and constantly seeking it is really, really important. So thank you.
Candelaria, thank you so much. I think we got a great comment, and as well, it coincided with exactly what you were saying. So you also echoed digital divide, but you also touched on the fact that in order to reach the diverse people that we need to and have inclusivity, we need to also appeal to them, or translate to the diverse languages and needs that we all have. So namely, making sure that our surveys are translated to Spanish, or we seek out those communities, and we seek out the communities from diverse backgrounds. And we got a great comment from Don Emmerich, who said survey reach is very important, but we must be sure that the survey questions are not biased in of themselves. And this shows that our conversation today is very nicely intertwined with our conversation last round when we talked about identity. So these two things are intertwined. In order to address the issues of reach, you also need to address the issues of identity. So I think that's a really good representation to have in terms of how do we build the surveys to then appeal, have it be appealing to a diverse group of people so that we can get that reach. And you also touched on resources and timeliness. And I think that's a really good topic, and it'll segue into our next panelist that I'd like to introduce. So our next panelist, our wonderful panelist, is Demonte Alexander. Demonte Alexander provides leadership for internal, external communities for Fairfax public opinion research. This encompasses public relations, marketing events, digital social media, and collateral development. He joined Fairfax in November 2019 as its first director of communication. Demonte has over 15 years of experience in communication and community outreach, very relevant to today, with expertise in strategically positioning public outreach campaigns and initiatives of all sizes. Demonte has honorably served 10 years in the US Army and received awards for his valor and efforts in combat in Baghdad, Iraq, during Operation Iraqi Freedom 2. So Demonte, take it over for us and tell us more on the topics we've been talking about.
I did it, I unmuted myself, good job. So I wanted to, number one, just thank you guys for the opportunity to speak. This is just an amazing panel, an amazing conversation that I'm sure it's gonna be the catalyst to a lot of things that happen as we move forward in terms of using data to make our decisions. One of the good things, there's a couple of good things about going last, is that most of everything that everybody says, it kind of, there's good signs too, when you have prepared good notes, is when the people before you kind of use everything that you were going to say. So that's good. So it leaves me with very little things to say, but I will touch on a few things. And Luana, Candelaria, could not agree more with what you guys have said. And it's just amazing work. One thing I did want to touch on, which I think Candelaria and Luana did touch on briefly, was cost. And so when it comes to reach, I immediately think about the cost, right? So cost can be a barrier to that reach. For example, at Fairfax, we poll, roughly about 600 to 650 individuals quarterly. That costs us about $48,000, about $40,000 for each poll. And so, as you can see, but that's only surveying about 600 to 650 folks. So I say that to say, basically, the cost of bad research is higher than the cost of good research. And the thing that we have to consider is the public is, when it comes to reach, the public is no longer interested in answering unsolicited phone calls. And I think you guys have seen during COVID-19, when you're doing the contact tracing, people are just not picking up. And that's, there could be a lot of, I'm sure you guys have a lot of reasons for that, but just now that people have transitioned from landlines to cell phones, we're just not about that life, right? So you try to really screen those calls. And just most people, and the other thing is response rates. And so when I'm talking about all this, I'm talking about in terms of things that drive up the cost for the reach that we're looking for. And in order for, I feel, and I apologize, I'm rambling here because like I said, most of my things have been said already, but I'm going to try to bring this all together. I'm addressing when it comes to cost, when it comes to the reach that we're going to need to have in terms of getting the data we need for removing bias in public health. That's a huge sample size, and so the things that drive up that cost are these things I'm going to mention. But also, I think the city of San Antonio, along with maybe a public-private partnership, would be ideal, because in order to accomplish these goals, we're going to have to pay for that. Response rates also, about 10 years ago, response rates were about at 30 to 40%, and have now dropped roughly to 5%, have declined by 5% in response. And it translates to a higher cost due to the number of attempts when you're trying to get somebody on the line. For context, when we poll, pollsters need about 10,000 numbers or more to complete about 300 person survey. We're currently, like I said before, we're currently sampling around 600 to 650 participants per study. The reason for this is the Consumer Protection Act of 1991 prevented auto dialers from calling cell phones, which I know we're all happy about, right? But at the same time, it prevents us from really reaching out to the folks who have those cell phones the way we need to, and now cell phones must be dialed manually. I think in terms of reach, also we need to consider the mode. I know from what I'm hearing from 2018, I think Metro Health had and correct me if I'm wrong, Metro Health last study was 2018, and I think it was all online. Is that correct? Yeah, and so when it comes to reach, and I think Candelaria and Lawana mentioned it, you have to mix the modes, and you have to use those different modes to make sure you're reaching different populations, different groups of people. Like, for example, lower income people of color, specifically immigrants, are not likely to respond due to a fear of immigration, due to a fear of discrimination and profiling, right? So you got to find different ways to reach them. You also have to build trust, which I know we'll talk about later. I won't dive in too much, but you're going to have to partner like CivTech and Geekdom and the city of San Antonio have now partnered, which, you know, rather than say Geekdom calling a resident saying, hey, we're going to do a poll, they may not trust Geekdom, but they will trust the city of San Antonio or CivTech. So it's important to have those partnerships for reaching out to build that trust. But I know they'll address that later. But also responses vary based on culture. They may not want to give those details because, again, that trust has not been built. And I will close by talking about some of the biases that we talked about, and just to say great decisions come from good data, and good data costs more. And I'm happy to know that we're making that commitment. I'm hoping this is what this is that we're making that commitment to whatever it costs to get the good data that we can use to make the best decisions. And that's one of the reasons why we created BearFacts, is because every major city in Texas has a dashboard, if you will, that really monitors public policy and public opinion, right? And San Antonio didn't have it. And so now BearFacts is there I was talking to Lawana earlier, is that your CEOs, your C-suite executives, all the big wigs in town, they all get this data. They all see this data. They all make their decisions based off of this data. CPS Energy calls us to get our crosstabs. And I'm like, okay, well, why do you want the crosstabs? Well, we want to know what our customers are thinking, which we probably shouldn't lose customers, but we want to know what our residents are thinking so we can cater our services to those individuals. And what BearFacts is, it puts the power of this information right in Mrs. Jones and Mrs. Martinez's hands and say, look, I have the same information as Paula Gold Williams, and I can take this to the mayor and say, look, this is what I've been talking about. Our communities are disenfranchised. Now I have this information to make my decisions from, and I think that's powerful. We also want to collaborate with the community because, like we said, these things are expensive. So say you're a small nonprofit, like CASA, for example, and all these years you've been screaming child abuse is a problem. Child abuse is a problem. We need funding. If you look at our latest poll, 81% of people across the board, across all demographics, say we need to address child abuse. So now CASA can take that crosstab and say, look, we need your money. We've been screaming this shit. Oh, excuse my language, but we've been screaming this. Give us money, you know. So I will close with biases. You're absolutely right. And one thing that we work on every day is how to remove those biases. There's a bias in our responses, any wording that influences our response. There's a regional bias, which taking a survey from one area or another, which I'm sure I'm not I'm sure most of you guys know this stuff, but just for our audience that may not understand, I'm going to lay these out. There's volunteer bias. You know, it may be great to get volunteers, but at the same time, anyone can participate in that. We've had, on our online surveys, we've had people take it from Canada. You know, I'm not really interested in what people from Canada have to say about San Antonio. So that bias. We also
Hey, I'm Canadian.
We also have convenience. Like sometimes we're just surveying and polling folks who are around us, who we have easy access to, and we have to be mindful of that. There's undercoverage, which that's one thing that I feel that Fairfax we can do better. For example, and let me know if I'm running over my time. I didn't think I would use this much time, but I'm getting excited. So one thing that we do that I feel we can work on in our data is that we only poll likely registered voters. And there's a reason for why we do that, but sometimes that is not conducive to depending on the type of data that we need. So if we're talking about public health data, like we're gonna have to expand that into how many, because obviously people that vote are not the only ones with health issues, right? Usually the people with health issues are the people who are not registered to vote in communities of color that are disenfranchised. So if I have to say that that's something that we need to work on is okay, how do we, from what I understand, it's costs, right? We're paying, $40,000 a poll. For us to start to expand that, you can see how expensive that gets. But also the last thing is non-response. And so when a large fraction of the sample fails to respond, those are all the biases that we need to keep in mind when we're doing this work. But what I see as a big barrier to our reach is what cost are we willing to pay to get the information that we need? And I will close with this work is like a map. A map will get you to where you want to go, right? But survey research is the map will give you confidence, basically. A good map will get you where you want to go, but with a bad map, you confidently march off in the wrong direction and end up with terrible consequences. And so that's why it's important to have this data to get us in the place that we need to be, in the places that we want to be. And so I'll close with that. Sorry if I ran over.
Well, after hearing all three panelists, I'm just saying, we need to have 3 more hours of conversation. This is not enough because you just touched on so many things where I just want to continue talking. So I don't know how it's going to happen. And DeMonte, I think you contributed an incredibly unique amount of information here on top of the great things that the other panelists have said. And you sort of got into the technicality of it. And that speaks to my heart, because when you say non-response rate, and that's exactly what reach is. And I think the quote you said in the beginning, you said bad data is more costly than, what is it that you started with? Bad data is more costly than? Yeah,
so the cost of bad research is higher than the cost of good research.
And I love that, because this is something that we all live as, all of us who are concerned with collecting data and making decisions about it. That really stands out. And that's why the topic of reach is so important today. And I think it's really cool to see how it's intertwined again with our next session. Trust determines reach, right? And identity determines reach. So this is why all 3 of these sessions together are really going to be good when we put it all together. And obviously we cannot talk about one without touching on the others. So thank you so much for that. And about the non-response rates. And again, the cost is why we always go to digital sources, because it's cheaper. And then we run into the digital divide issues. So on that, we did get a comment from Crystal Alexander, and Brian did a great job responding already, but I'll pose it all to you in case you all have comments in response to her. She said, I'm curious if the digital divide is closing a bit because of COVID. People are being forced online. Even my grandma, who never ever used technology, received a picture I sent her via text. That was huge for us, but we see it everywhere. Internet companies are saying that they are flooded with calls and schools are handing out tech to students. I guess my question is, do you think the assumption that things are getting worse is true?
Well, and I guess, and I do agree with you in the sense of that so many people were kind of propelled to this online platform. I think the correlations to why I was assuming that it was getting worse have to do with resources. So as people are getting laid off, as people are fighting for resources or having to pick or choose between paying their electricity bill versus their water bill versus their internet bill, which one do you think is going to be the first one that's going to go? So I think it's more about the issue of sustainability, that right now a lot of agencies are kind of stepping up to fill in gaps and create short-term solutions. But what's going to happen long-term? You know, internet is never free. Somebody's always paying the bill for internet. So where's the resource going to keep coming from for schools to keep handing out hotspots, for other entities to kind of step up and provide that gap? So for us, we want to make sure that when we look at the digital divide, it is kind of a long-term strategy and not a moment in time. I do feel like this conversation is gaining a lot of momentum because it is kind of at that foundation of so many elements of it that we already explained with education, economics, workforce development. I mean, where were you going to go to fill out your unemployment benefits? The library was closed, community centers were closed. So if you didn't have internet or a computer at home, what were you going to do? It's really hard to fill those out on the phone if you've ever tried. So I think it's just those conversations of not just kind of the simple tasks of social media type things that you can do on a phone, but the full benefits of being able to get on a laptop and opening up more softwares and, you know, seeing things better, filling out applications, things that are more complex and time consuming. I mean, even just as an example, on the Northeast side, which is the school district that I feed into, they had a line going like crazy. They actually had to like shut down because they got so many people asking for devices, and we're on, you know, the more wealthier side of town. So when you think about having to share a device, or that a family might have a computer or two, if there's 2 or 3 students plus 2 parents working at home, I mean, that just opens up the box to a whole other environment that we're not used to. So it is a very complex topic. And so that's kind of why I'm making the assumption that it's getting worse, because the reliance on it is so much more heavier now.
Yeah, and I think to add to that is that it depends. It's all relative, right, to who you are. If it's getting better, if you have that stuff, if you have access to all those things, then you haven't been affected. But I think Candelaria speaks to those individuals who lack access to those things. And what I hate is that it took a pandemic for us to get to this point. I think this is why citizens are upset with local government. Is that it takes, it's like a push cart. You push it, it stops. It won't roll unless you push it, right? Or unless something just happens. And I think we have seen these changes in the Office of Innovation, and what you guys are doing. You're being proactive about these issues, and data is a crucial component to that. So I echo Candelaria's comments.
Thank you so much. So someone else going to talk.
There it is. Sorry.
Oh, there we go. Sorry, LaJuana.
Just real quick, to Demonte and Candelaria's points, you know, absolutely, when you look at the digital divide, and let's go back to some stats, right? You look at, I think it was March or April this year when I was having this discussion with Girls for a Change and Tiffany Haddish. It was a fabulous discussion. But I think at that point, we were looking at maybe 45% of Americans not having access to robust, affordable broadband internet. So you look at the recession, you know, look at women, okay, especially black households. Black women are the ones who are the bread makers, the breadwinners. So you look at our recession that we're in right now, because a lot of us have lost our positions. We've lost our jobs, right? Because of the pandemic. A lot of us are frontline workers, as you all know. So you look at the fact that we don't have access to capital to, you know, be able to pay our mortgages and pay our utility bills and things of that sort. The first thing that's going to go is going to be your broadband internet connection, because you're going to be looking to the public school system to support in that way, or, you know, you might even go to McDonald's to use their public Wi-Fi, and other, you know, like the San Antonio Public Library system here has a similar sort of setup where if you can get, I think, within range of one of the libraries, you can tap into the Wi-Fi. So absolutely, to, you know, Demonte's point especially, it is very relative. But thinking about the condition that we were in prior to the coronavirus and looking at where we are today, our people are hurting. And when we think again about the digital divide, you have to remember that we're talking about the user. It's very user specific. So we're thinking about privacy. We're thinking about digital literacy. Are you using devices that are going to be suitable to the work that you need to perform? So if you're going back to school, do you have the correct device? And we're thinking about, with the digital divide, we're also thinking about our, are you using Google Chrome? Are you using Safari? Are you using Internet Explorer? How are you getting to the World Wide Web, right? Because they process RAM differently. They process so much memory sometimes that it kills the device's battery. So you've got to be thinking about devices, and you got to be thinking about the user and what's suitable for them. And obviously in this coronavirus pandemic, we have really lost access in many different ways to things that our users are going to be needing in order to get through this thing.
Beautiful. God, we need to go on for another hour. And I love the word digital literacy. I love that. And, we've coined the term health literacy in public health, and we really need to, mix it and, intertwine with digital literacy. And I really love that all the speakers are talking about the technical and detailed, nuanced issues that would lead to a digital divide. It's not as simple as, hey, I have internet access versus I don't. And when it comes to reaching them, for data collection, there are its own host of nuanced issues. So it is a lot more complex like that. And this is why it's great to start addressing them with these conversations, getting into the details. So thank you so much. I think we have another comment expanding on Lahwana's comment when it comes to tech entrepreneurship and building new technologies. What are some key things that can be kept in mind when it comes to reach and addressing the digital divide? So do we quickly want to touch on that? If there was anything else to say, I know we're running out of time. No, not yet. So
I was looking at Devontae. No, I would just say really quickly, one of the things that I know I look for, because, I kind of have I wear several caps in this space because I'm the consultant who goes into the organizations and helps them, determine what sort of data they should be collecting. With their different programs, right? Your programs need to be making revenues, but in order for them to be making revenues, there's certain types of data information that you have to collect, right? So I kind of help them out with the anatomy of technology, because you can only be as what Devontae said. Anyway, so going back to that point, reach then for me looks like being really being cognizant of accountability. If I'm going to be collecting, for example, PII, personally identifiable information, how am I handling that information? Am I locking it up? Is it digital? Am I shredding information after I've received it? How am I encrypting messages if I'm communicating back and forth? If I'm having to receive payment information, how am I handling that information? So all the things I think we take for granted, and this goes back again to the digital divide, because a lot of our consumers, our users, are not really cognizant of the fact that everything can be monetized. Everything about you can be monetized. So you have to be really careful of what you forfeit. But that's a whole other conversation. So I think for me, being in the private sector and really relying on data to help craft reports and other predictions for policymakers, my part in this is making sure that I'm very curious about how those who are giving us the information, how they want that information, the life cycle of the information. Do they want whatever I'm taking, whatever I'm collecting, do they want to see it once I'm done, with making it make sense and making sure that it's something that's actionable? And if they do want to see it, then I can prepare that separately, and I build that into my invoice. I build that into my consulting rate, so that way I'm not losing time and effort for that. But that's a lot of my colleagues don't do that because they don't think about how the data needs to go back to the people that which gave it to you. But I think that in the private sector, we have to be very cognizant of that, and we have to be leaders in that way, to remind people of their power and to remind them that they should have access to this information just like we do.
That segues so nicely into trust. So definitely tune in for the next one, for the next session next week.
She said that much better than I would have.
La Juana segued exactly. All right, so I'll pass it on to Leslie. Thank you so much. That was so thought-provoking, and it just left us wanting a lot more. So I'm excited for other questions that will come of this.
Can I just throw out a quick shout out? So I know that there's a lot of interest around digital divide. How can you support what's going on? What's all about the conversation? If you are interested, I'm going to put in my email into the chat. Reach out. We actually do have a Digital Inclusion Alliance of San Antonio, and we also have a Digital Inclusion Task Force that we kind of pulled together when COVID hit. There's a pretty long history of the digital divide that is very complex and has a lot of layers around redlining and similarities to that, whether it's considered a utility or not. So if you ever want more information, it's just going to take a lot more time than we have here, but I'll put my email in the chat. Feel free to reach out and I can plug you into those meetings, or we can have a briefing if you want more information.
Wonderful. Thank you so much for adding that, Candelaria. So thank you again to our awesome panelists, Demonte, Luana, Candelaria. It was so wonderful to have you with us today, sharing your perspectives and your knowledge from the work that you all do on this topic and in our communities. And thank you, Golareh, for leading the panelists through this. We had so many great comments and insights and just momentum here, kind of building on these conversations as you kept pointing to. These are all intertwined, right? So it's really great to see how these are all continuing to interact with each other. So thank you again, panelists, and thank you everyone for joining us today. We're gonna move into the last portion of our event. So we're gonna take all of our attendees and we're gonna move into a breakout room, and Emily Royale from our Office of Innovation is going to ask y'all some questions so that you have a chance to really speak up and share some more thoughts on the topic. So thank you again, and if you're watching on a recorded thing or you're watching live, be sure to register for next week's topic on trust. So same time, same place, Zoom at noon, register on Eventbrite, and you can join in on another conversation that, again, all these topics touching each other, they're all mingling. So we'll really dive into trust with a new panel. And also please go to the CivTechSA website, look at that case study, give us some more feedback. We really want to hear from you about what you're seeing in that health priority survey or priority health survey that Metro Health did. What could have been done better? What do you see there that might have been an issue or could still be an issue? And if you have other feedback from these conversations, just put them in that form as well. We want all the feedback and responses we can get. So thank you all. We're going to move into our breakout rooms.